Today, we are presenting on African American maternal health. The United States faces a maternal health crisis, with Black women disproportionately being affected. The purpose of this is to explore the disparities that these Black women face and understand the contributing factors and discuss potential solutions.
Um, Black women die in childbirth three times more often than white women, and maternal mortality rates are also much higher for Black women, with for every 100,000 live births, about 50 Black women die, whereas only 14 and a half white women, about 12 Hispanic women, about 11 Asian women die, and overall it's about 18.6 deaths per 100,000.
Black patients are also 22% less likely than white patients to receive pain medication, and Black infants have the highest rate of preterm births at 14.8% of births. The second leading cause of maternal death, as reported by the CDC, is discrimination, and overall, 80% of maternal deaths have been deemed preventable in the US. Some factors that we're going to go into in more detail in the next slides are economic inequalities, access to healthcare, and discrimination.
Education and income are two things that severely disproportionately affect Black women. Black women with higher education levels still face higher mortality rates compared to less educated white women.
There are also some contributing factors that are systemic issues, such as implicit and explicit bias in healthcare settings. For example, only about 5% of images in medical textbooks include patients with black skin. Secondly, there's structural racism that can lead to chronic stress, also known as the weathering hypothesis. And then there's also limited access to quality prenatal and postpartum care.
So a profile, just to give an example of a specific person who has experienced this bias, is Serena Williams. In 2017, she went through an emergency C-section to deliver her daughter, Alexis Olympia. And the following day, she was experiencing shortness of breath and suspected a pulmonary embolism, which she had had before. So she brought these concerns up with her healthcare provider, and a nurse dismissed them, attributing them to confusion from pain medication. After she stood up for herself and demanded further treatment, she was able to get an evaluation. And these tests confirmed that she had multiple blood clots in her lungs, and then she received the critical care she needed. Serena's experience is not unique, and it shows the implicit bias in the healthcare system, even for well-known successful women. Some policy initiatives. There is the Black Maternal Health Momnibus Act, which is like a comprehensive legislation that addresses some of these maternal health disparities. It does this by investing in social determinants of health, community-based organizations, and increasing data collection. There's also the Medicaid postpartum coverage extension, which under the American Rescue Plan, states can extend Medicaid coverage to up to 12 months after birth. And because Medicaid finances approximately 65% of births among Black women, this extension is vital. It will help improve health outcomes and reduce disparities. And here are references. Thank you so much for listening to our presentation.
Love you all.